In 2019, we started to explore who we wanted to be in the genomics space. We considered buying a genomics lab, trying to understand if we wanted to bring that in-house or not. I think this ability to be able to shape what population health genomics looks like was very intriguing to us, but we also knew that we wanted to be a player in this space. And then we just really decided that we're really good at care, but we wanted to find a partner who had the same beliefs that we did. I think bringing population genomics into primary care is critical because we talk about being wellness centers as healthcare and not just wanting to treat disease, but wanting to prevent disease. And you can't do that if you don't know that you're at risk. So we wanted to be able to use genomics to help guide decision-making with our patients and partnerships to really impact people's lives long-term.
We really believe that if a physician in primary care, which is very busy, can have access to this information, you can actually make more tailored, quicker decisions into what a person's screening plan needs to be.
My sister-in-law was able to get sequenced, and she knew that she had BRCA2, so she was followed by her doctors very closely. They ended up doing some proactive steps, and she's doing very well right now. My sister did not have an opportunity to be sequenced, and she has stage 4 breast cancer and didn't find out, didn't know her risk, and her prognosis is very different, right? So I have 2 sisters, 2 different situations, and so we just want to make sure this is available to anybody and everybody, and it's not only available to the wealthy or those who have a connection, but if it's something you're interested in and you want, then you have access.
As a laboratorian, there are certain tests that we call once in a lifetime, and a genetic sequence is once in a lifetime. You only need to do that once. And so just sort of seeing the possibility of watching our clinicians send out multiple genetic tests over a lifetime, seeing the cost of those tests, we just knew that if we really could sequence everybody, there'd be a lot of answers we could provide in the future.
Well, our initial goals are 100,000 people over 4 years, but our expectation is that we're gonna blow that out of the water. I think we've got almost 16,000 people enrolled in 4 months already as we've started the program. And we are hoping that the more we get enrolled, the more excitement there is, the more people want to participate, and that this will just keep going.
Many labs, like the ones I run, we don't do sequencing. It is not our expertise. It takes a lot of experts to sort of do what Helix does every day. And I think it takes a lot of infrastructure and vision. So we knew they were the right partner when we saw that part of their mission and vision is to improve health. Well, so was ours. And so that felt like a match made in heaven, that we were actually gonna have the same values moving forward.
I think if anyone is considering this type of program, I think the first thing is to understand who do you want to be in the genetic space, and what do your clinicians want, what do your care teams want. And then I think recognizing that this is happening across the country, that others are doing this, and then asking yourself the question of what level of care then do you want to be able to provide for your patients, your community, your family. I would challenge anyone, if we say we're about wellness and health, then it is about proactively identifying risk and supporting people to make the right decisions to mitigate that risk. And that's what we have to shift to. We can't just keep treating things after they've happened.
I think the overwhelming majority, based on our quick enrollment, is that people really get it and it's meaningful to them. If you're a health system that's committed to improving the health of the patients you serve, then population genomic screening is right for you.
In this time, you've got to decide if you're going to help lead this work or if you're going to lag behind or if you're not going to be in the game at all.